welcome to Beaumont, Wayne. Just want to give you a little introduction to our program and to the office here at Westland. We opened up this office back in 1998, and we've had some great upgrades. I'd like to take you inside and show you around. So welcome inside the Westland. This is a picture of what I call the Grand Canyon of Westland, because we're a 17,000 square foot facility, and we have plenty of MAs and medical office assistants that work with you every day. You're assigned one, and we have nurses to answer phone calls for you and work triage and take care of a lot of our insurance needs and things like that, like referrals. All right, this is hallway A. We have 3 hallways, A, B, and C. We have 30 examination rooms, and each resident gets about 3 rooms every afternoon or morning that they're working here. This is just an example of one of the rooms. All the rooms are fully stocked. As you see Dr. Al-Jami working here. They all have their own computer access and personal protection equipment and everything else that you would need inside the room to take care of patients. Well, welcome to our dedicated precepting room. In here, we have an area where every day we have 3 preceptors to work with our residents. It's usually a 1-to-3 ratio. We also have a video capability to run conferences in here and to watch sporting events if it's something big like the Tigers playing in the World Series. All right, this is one of our procedure rooms. It happens to be our OMT room where we have a brand new OMT table. It's completely mechanical. We also have a very nice ultrasound machine to work with both sports medicine injections, and also we do a lot of OB ultrasound. We are working on a curriculum for point of service ultrasound as well for gallbladder and other parts of the body.
Okay, so we have Dr. Boggs here with us today, and he's going to talk a little bit about the osteopathic side of primary care in this clinic and OMT in this clinic.
Yeah, so OMT here at Beaumont, Wayne, in our Westland office, what I like to say is that our curriculum is very inclusive to all of our residents. If the allopaths are interested, we would definitely include them in any of our training. But ultimately, the curriculum is designed to assist our first years in getting their hands on patients. And then as you develop into your more second year training, your skills will include patients in your clinical practice. We want to make sure that we have a continuity clinic where you're seeing osteopathic patients and trying to work that OMT into your daily practice. And then as a third year, you really hone down skills in billing and hone down skills to really practice independently, seeing those patients and putting your hands on patients on a daily basis and really trying to give that physician touch to people. I think osteopathic medicine, for that reason, you really can bond with your patients on a whole nother level as far as again, having that hands-on touch with patients. And I think that OMM is a great tool to use, whether you're an osteopath, and in this program you could also be an allopath, and we're going to make sure that we include you in that. So, yeah.
This happens to be our procedure hallway where we have 3 procedure rooms. We've already seen the first one. These are 2 other procedure rooms. In here we do quite a few procedures, like vasectomy, nasal laryngoscopy, lump and bump skin, shave, Nexplanon insertion, IUD, and pretty much everything else that you can think of. We also have casting materials for a lot of our sports medicine and sprains and things like that. So these are our 2 exam rooms that we have for extra space in case it's a day where we need more examination rooms. In here we have our pulmonary function testing and also our retinal eye scanning, which is important for taking care of patients. All right, this is an example of one of our 4 resident physician offices where you can have this room assigned to you for a couple of years, and you get to come back here and decorate it the way you like and work through here as you're seeing patients. All right, this area of our office is our behavioral science area. We have some great things in the office. Dr. Larry Fischetti is our clinical psychologist. He not only helps you with doing OSCEs and how to manage difficult patients and doing motivational interviewing, but he's also here to see our patients, which is an amazing resource, so you can have your patients come right over here and see the counselor.
Welcome, folks. Looking forward to having you come and interview here, and in the future working with you at the Westland Clinic. It's an excellent program, and we've got very strong residents and strong faculty, and so we're looking forward to meeting with you and working with you in the future.
So this is our Starfish folks. They are medical social workers that are in our office every day. And when we get to a point where a family or a child needs more resources or time than we can provide, we can bring them in. They do an immediate assessment, and then they can get them hooked into things in the area that will be helpful to them, like counseling and other things. And finally, our other person who's very important to us from the behavioral science standpoint is Dr. Catherine Littau. She is a full-time psychiatrist who's on staff with us. Her only job is to see patients with us and to precept with us. So she is here all week long to precept cases on difficult psychiatric patients or depression, bipolar with you. She's also skilled in addiction medicine and in child psychiatry. I'd like to just take a minute to show you the other side of the office that has other services that we can provide to our patients. We have our pharmacy, which is staffed with a pharmacist and 3 techs. It's great to be able to come over and ask questions about the medicines that you're using if you have any concerns, and also nice for us to be able to pick up our medicines right here for a service for your family. We also have a great lab drawing station with 3 excellent phlebotomists so that it helps keep the patients moving through our office, that they come right over here and get their blood draw done and can keep up on their labs, and it's a nice service right for the patients. And this is our conference room and area, our cafeteria, where we have plenty of areas to have lunch. Some of our great staff have taken a moment and break after working so hard for us today. We have in the conference room, we have a lot of educational opportunities. We have a unit council meeting where you learn about business every month, where we learn about taking care of our PCMH needs, finding out how we're doing compared to other doctors with writing narcotics and referrals and things like that across the state of Michigan, which is good for our residents to learn going out and practice. We also do practice management here, and we also do our case conference where we present unique cases that our residents have seen here in the office, and we present those as a group and talk about them. Another unique opportunity at our site here is that we can do x-ray right on site, and Trish is here taking care of it, so you can bring your order just digitally, comes right over to Trish. She comes and picks your patients up, does the x-ray, and within minutes it's already up on the screen in your office where you're seeing patients at, and it also goes immediately into the bucket for the radiologist to read the hospital, so you have a read probably within 15 to 30 minutes. And Trish is in here. She's got some new equipment and does great film. She's been with us for many years, and she's an excellent radiology tech.
Hello.
I'm now at our Wayne County TB clinic that Beaumont sponsors, also an HIV clinic, and it's immediately adjacent. You walk through a door, come right into the clinic. That way you have access to ID doctors if you have a problem like we did the other day with multiple cases of gonorrhea in the same person. You can come over and have a nice intelligent discussion as to what we should do to take care of that person right on site. We have a lot of staff here, and Michelle is one of our nurses. She does a lot of our triage work and
Hello.
chasing down any problems. So if you are at ICU and you have a positive chlamydia test, there's always someone here to watch out for your box, communicate with you, and make sure your patient gets taken care of at a time. This is our medical student and resident lounge, where we have a place to kind of get away from all the noise of the day. You got a microwave, a refrigerator, place to hang out and to rest up and have a moment of wellness. All right, I hope that the tour around the office was helpful to you, at least to see some of the important areas of our office. I think the most important thing about our program are our wonderful residents and our faculty who really enjoy working with them and care about their development very much. So we're looking forward to showing you all these people throughout the rest of our tour, and look forward to meeting you during the interviews. Thank you.